So, good day. Today, I will be demonstrating the breast examination. So, first thing, I will do the obtain health history. I will ask our patient for chief complaint and past history and present history, family history and medication, history, medication, habits, and nutritional and self-care behavior, and psychological status. Then, I will prepare the equipments needed for this procedure. I will be needing a symmetric ruler, small pillow, gloves, client's hands out for breast and self-examination, and slide for specimen. Then I will prepare for our clients by examining the procedure, and then I will provide the patient privacy. Then I will wash my hands and put our patient's desired position for patients they will visit. Then I will expose the body part to be examined, and then I will drape the patient. Then I will expose the body part that will be examined. I will appropriately compare the findings of any side of body and other application for techniques. So I will inspect for the breast. So for the physical examination, the female breast, I will inspect for the size and symmetry. And I will explain that and is the client's anxiety. And then I will inspect for the color and texture. Be sure to note the client's overall skin tone, and inspect the breast skin and note for any lesions. Then I will inspect the superficial venous patterns, and I will observe the visibility of patterns of breast veins. I will inspect the areolas, note the color, size, shape, and texture of the areolas, both of the breasts. I will inspect the nipples. I will inspect the nipples. Note the size and direction of the nipples of the breast. Also note any dryness, lesion, bleeding, or discharge. Also, normal finding reminder that nipples are nearly equal size, are the same location on each breast. And nipples are usually everted, but they may be inverted or flat. So for the inspection for retraction and dimpling, I will ask the patient to place his arms overhead. So ma'am, can you raise your hands overhead? So to inspect the breast accurately for the retraction and dimpling, I will ask the patient to remain seated, maneuvers. And I will ask the patient to raise her hands over her arms overhead. Then press her hands against the lips. And I will ask her to press her hands together, this traction vertebral muscle. Fine. Then the final, I'll ask the patient to lean forward from the waist, and the nurse should support the client on the hand or forearm for the good position. And okay. In the palpation, I will have to use my gloves for palpating the texture and elasticity. I will palpate the texture and elasticity. The palpation must reveal a smooth and firm elastic tissue. Then I will palpate for the tenderness and the temperature. So find position, and then palpate, raise her hands over her head. Then I will cover one of these breasts. cover one of his breast and the ground while examining the other. I use superficial then deep palpation using gently rotator motion. One pregnant female breast is normally firm and smooth and elastic. From mid-cycle up to the menstrual breast is slightly enlarged. Perform for the palpation technique of the breast. First is parallel line. Then I will spokes on a wheel. I will do a rotational concentric circle for the palpation. You can use counterclockwise, or then I will palpate for the masses. Note for the location, size and centimeters and shape, mobility and consistency and tenderness, and also note for the condition of the skin over the mass. If you detected a lump, the patient is referred as a further elevation. Then I will palpate for the nipples. Wear gloves and compress the nipples gently with thumb and index finger. Then note for discharge if spontaneous, and discharge occur from the nipples. Specimen must be tied to a slide and smeared into the laboratory and psychological evaluation. Then I will palpate for mastectomy, or then it is still important to perform a true examination. Is Swedish to with the redness or swelling or no lesion lumps in the tenderness noted in the mastectomy. Is to palpate the scar and any remaining breast or axillary tissue from redness, lesion, lumps, and swelling or tenderness. The axilla, I will inspect and the palpation of axilla. Inspect and palpate the axilla. Ask the client for to sit up and inspect axilla skin for rashes or infection. The axilla is in the underarm. Note for the rashes and infection. So, no client's elbow with one hand, and use the 3 fingers pad or other hand to palpate firmly the axilla lymph nodes. Then, first palpate the high into the axilla, then moving downward against the rib to feel the central lymph nodes. Continue to move down to the posterior axilla to feel the posterior lymph nodes. Use a binomal palpation to feel for the anterior axillary lymph nodes. Finally, palpate the inner aspect of the upper arm. Notes, we have to use a lot of lymph nodes here in this area. But there's anything enlarged, you would like to take note of that. Okay, I will be ending my presentation.